And this is the Barts Cancer Research Institute. It would be good to know a little bit about this for your interview, as it is something that Barts is quite proud of. So, this is something that's definitely good to talk about and to know a bit about their research as well. And it's also something that you could look forward to getting involved in.
Okay, so just to introduce myself, my name's Jeannie. I am a medical student at Barts. I'm in first year. Um, I'm doing this presentation with Sammy, who is also a first year medical student at Barts. So I'm going to talk to you now about why Barts. So you guys have all applied here. So I just want to go through some reasons which would be good to mention in your interview for why you should come to Barts. So let's start with early clinical experience. So at Barts, you start GP placements in year one, which is good to get clinical exposure. It's good to get patient contact to start with because you're building the scientific foundations in medical school. You know, you're learning your scientific theory and you're learning about key principles and parts of the body and the biology behind disease and things like that. But the skills that you would use in patient interaction, like your soft skills and your communication skills, are just as important. So it's good that you're getting early clinical exposure in the first place. You can kind of develop those clinical skills and those kind of patient interaction skills from year one onwards. So we have GP placement once a fortnight. Obviously, from second year onwards, you'll have different clinical and patient contact, but you start really early with that one. Secondly, PBL, which is problem-based learning. So this is pretty much just small group work, and you come across clinical scenarios about patients, and usually the topic will be linked to what you're learning about that week in lectures. So it's really good that you can apply your knowledge from what you've learned or what you are learning. And you discuss the key principles, key issues, and things like that with your PBL group. And it's good because you can kind of develop different perspectives. You can look at things in different ways and you can have discussions and kind of debates and argue your point across, I suppose. And it's good because it encourages teamwork, and teamwork is obviously very important in medicine, as you all know, because of the multidisciplinary team within a hospital, where you as a doctor will be part of a team with nurses and other allied health professionals. So it kind of encourages teamwork from the get-go and also looking at things from a different perspective. So thirdly, prosections. So in our anatomy labs, we do have prosections. If you don't know what prosections are, it's basically when the cadaver is already cut up for you and it's kind of there to display a specific anatomical structure. So you won't have the entire body in front of you. For example, if you're studying the lower limb, you wouldn't have the entire cadaver, you would just have the lower limb and maybe even cut open and showing specific nerves or vessels or whatever you're learning about. And prosections are useful because it allows you to kind of focus on specific anatomical structures and you can learn how to identify them, you can learn what they look like, and it's a lot easier that they're already cut up and there for you to look at. Um, so that's what Barts uses, and I'd say it's pretty useful for learning. You you do get opportunities to dissect, but I'll talk about that in the student selected components. So I'd say one of the most important things you can mention in your why Barts answer is the spiral curriculum structure. It's basically the course structure at Barts, where you start off learning about systems in the body and you learn about kind of what's happening in the body when things go right in first year and just how things are supposed to be. And then in second year, you'll come back to it and you will learn about the same systems in the body, but when things go wrong, so kind of the diseases and the clinical relevance of things. And then in third year, you'll come back to the systems again, but you'll talk about how to treat them and how to just kind of look at mitigating things. So the spiral curriculum, I would say this is probably one of the most important things you can mention, as that is how the course is structured, and the staff at Barts are very proud of their course, and as they should be, because it's quite a good way to reinforce long-term retention, and you can talk about how it suits your learning style. because obviously you have to use active recall and you have to kind of revisit things to be able to remember. So I'd say the spiral curriculum definitely encourages that sort of thing. So now I'll talk about student selected components. So like I mentioned with the pro sections, you do get an opportunity to do dissection. For example, if you're interested in surgery. Student selected components are basically a 2-week block, and you have two of these student selected components within a year. So you'll have two-week blocks, and it's where you can kind of choose something to kind of look into that's outside the core curriculum. So Barts just offer a wide range of things. For example, like I mentioned, dissections, or you can learn about the history of medicine, you can learn about arts linked to medicine, or histology, kind of more into anatomy, and you can even self-organize your own placements. And I'd say student select components are very beneficial as you can encourage your own learning, you can kind of direct what you want to learn about, and it kind of helps you to figure out what you'd want to do in the future based on what you choose your student selected components to be. It kind of allows you to explore different specialties. Now I'll talk to you about intercalation opportunities. So a lot of medical schools offer intercalation, but the most common intercalation would be a bachelor's. But at Barts, you're offered not only a bachelor level, but you can do a BSc, MSc, which is a master's, or an MD, PhD. So there are 3 levels of intercalation, which I'd say is, very useful. It's great that there are 3 different levels that you can choose from. It kind of gives you a wide range. It gives you different options depending on how far you want to go with your education at that point in time. And Barts offers a lot of different courses for intercalation as well, which you can find on their website. But you do also have the opportunity to intercalate outside of Barts if that's what you would wish. For example, if your course isn't offered at Barts. So it's just a good way to kind of explore what you'd want to do. Once again, kind of look into different specialties. And yeah, it's pretty unique that Barts offers the 3 levels of intercalation, as you won't really find that anywhere else. So next I'll talk to you about societies and programs. So we will talk about this more later on in the presentation, but Barts offers a lot of societies, and these can include kind of academic societies with different specialties. They offer sports societies, and because Barts is the medical and dental school, these societies have training sessions that are kind of structured around the medical timetable so that you're not having to kind of miss things in order to attend sports, and that it's not taking up too much of your time as well. So it kind of facilitates your learning that way. In terms of programs, once again, we will talk more about this, but Barts offers programs in different specialties as well. For example, pre-hospital medicine, where you can kind of experience the application of this in the real world by doing shifts with doctors in the Royal London. But we'll go into that more later. So let's talk about student support next. Barts has a very strong pastoral care support system, and you will hear more about it kind of when you come to Barts. There's a lot of staff that are available in case you need someone to talk to, like counselling, or if you're finding university quite difficult, because it is a big lifestyle change for sure. And there are also tutors to help with kind of work if you're kind of struggling with the work, for example. There's just a lot of student support that's available. And as well as student support in terms of counselling or work, there are also bursaries and things available like financial support. And finally, I'd want to talk about the location. Once again, we will revisit this, but Barts is located in East London, and it has 3 campuses, as Sammy mentioned earlier. And it's kind of in a very diverse area of London, and obviously it's in East London. It's in London, so you're kind of in the capital city. It's very kind of, there's a lot to do in London. It's a very good atmosphere to be in. Okay.
Worth mentioning kind of the specific hospital as well. So you can be like kind of Queen Mary attached to the Royal London Hospital, sort of major tertiary center. You're going to have lots of exposure to learning opportunities, high level procedures, that kind of thing worth referring to as well. Just show you that you know what the hospitals are. So
Thank you. Yeah, definitely. So you've got the Royal London and St Bartholomew's, which are both very good teaching hospitals. Um, yeah, so now let's move on to the demographics of Whitechapel in East London. So one of the main campuses of Barts is in Whitechapel, and this area has a very diverse demographic. There are prevalence of diseases such as type 2 diabetes because of the diverse and primarily South Asian population. Um, you can look into the different social factors that kind of influence the prevalence of certain diseases. So, type 2 diabetes won't be the only disease that you see popping up a lot. You'll kind of see heart disease, you might see hypertension pop up a lot as well. And this can be to do with kind of the diet of people that live in East London. It can be to do with even things like pollution and just general different social factors, which I think is very good to look into. I would also say look into some statistics about Whitechapel and East London. So, for example, here's one statistic I found from the Office for National Statistics. So, 44.4% of usual residents in Tower Hamlets identified their ethnic group within the Asian, Asian British, or Asian Welsh kind of ethnicity category. So, this shows that it's, a predominantly Asian population, and out of Asian, it's a lot of South Asian. And I would just look more into this and kind of think about how the fact that Barts is located in such a diverse area, you're going to get to see how the management of diseases will differ between different ethnic groups, and you'll kind of see the prevalence of different diseases, how it affects different ethnic groups as well. And I'd say it's quite a unique opportunity to get that at Barts because other universities might not be located in areas such as this. And especially because of like the diversity of London and the UK, it's very good to have an idea of how different diseases will present in different ethnic groups. Okay, so now we'll talk about common interview themes. So Barts has a interview which is half being an article and half being kind of typical interview questions. So within the typical interview questions, you will have these sorts of themes pop up. So motivation and reality of a career in medicine. So this could be kind of what made you choose medicine type of questions, and even why Barts being that sort of theme. And then you could get reality of a career in medicine. So basically, the interviewers just want you to acknowledge the challenges of being a doctor, and they want to see that you know what you're getting yourself into pretty much. They want to make sure that you haven't glamorized the idea in your head and that you have a very real idea of what medical school and being a doctor will be like. Secondly, contribution to university life. So when you talk about why Barts, you can mention the societies and you can even look into societies that you'd want to join. However, it's good to mention kind of what you can contribute to the university. So, for example, have you published research? Have you published an article? And would you like to continue this at university? That sort of thing. And just kind of, they want to see what you can contribute to Barts. They want to see what can you add, what's unique about you that, what is unique about you. They just basically want to see that. And they may also assess qualities. So this will be things like teamwork, communication, and leadership, kind of the qualities of being a doctor. And they might ask you for examples of this. We will talk more about this later, I suppose, but kind of when you have qualities questions, kind of making sure that you explain kind of what situation you were in and how you displayed the certain quality and how this quality akin to medicine and how it's important for being a doctor. So, for example, if the quality is leadership, what situation did you show leadership in? What was the task? What did you do to complete this task? And what was the result of this task? Then reflect on it and kind of mention how leadership is very important in medicine as a doctor, because not only are you part of an MDT multidisciplinary team, but you may also have to lead one. As a doctor, you do have to be a leader because you have the ultimate responsibility of the patient. So just kind of making sure you link it back. Then initiative, resilience, and maturity. So interviewers will really like to see if like that you take initiative. So this might be, for example, literally looking into societies beforehand and kind of saying that you'd want to join this, you'd want to research this, that sort of thing, and just making sure that you've really looked into Barts and that you've kind of gone out of your way. In terms of resilience and maturity, they might ask you something related to kind of overcoming challenges or overcoming difficult situations and how you went about doing it. Once again, this could link to qualities as well, since resilience is a very important quality of a doctor and a medical student. Finally, article research and analysis. We will go more into articles later on in the presentation, but half of the interview is about an article, and you have to make sure that you analyze the article beforehand and kind of have a good idea about the themes of the article and your own opinions about it as well.
If we just kind of, before we go on to the questions, clarify just because of the interview itself, there are a few people asking in the chat. So there's the article element, and that's, did I get right? 10 minutes, they're going to be discussing the article with you. And so that can be sort of ongoing panel style. Like it might not be five specific questions that can really relate to how the conversation goes. Then they have the sort of interview question style. How is that structured? So are there kind of five distinct questions, or is that also conversational? The second aspect.
So throughout my interview, I thought that it was all pretty conversational and friendly. So especially the part that's about yourself, it almost does feel like a conversation. So honestly, I wouldn't stress about it too much. I got asked about three questions about myself, but again, that depends on how much you talk each, like how long each of your answers are. And again, if you're talking too much and they want to ask you another question, they will like politely move it on. So yeah, if that explains that.
Makes sense. So, kind of for the people asking in the chat, what we're seeing is that it's not like some of the other MMIs where kind of it's like five stations, five questions, 6 minutes each. It will be conversational. So, it might not be that every person gets the same number of questions. It might be that it really depends on how you respond to them. And so, for example, if you're answering one really well, maybe they ask follow-ups about that, and they don't ask you completely different or random from the next question. So we've got an example here. Why don't we try it in that way? And so we've got, what would you find challenging about being a doctor? And let's try practicing it in maybe that kind of panel style. So if we've got any volunteers, we'll give you about a minute or so to have a think about this. And then put your hand up and we'll pick some volunteers. Give this a go. So what would you find challenging about being a doctor? As soon as you feel comfortable, hands up. You've got one hand up. Let's let it go to 1 minute and you can then start. And yeah, people, recording will be sent out to you afterwards, don't worry. So, Leora, whenever you're ready, what would you find challenging about being a doctor?
I think in terms of general thought, um, definitely being under that pressure of, especially if it's in an emergency, you have to narrow down certain symptoms and organize your thoughts into so many different places at once, and someone's life is on the line. It can be really gut-wrenching and hard, I think.
So you said that kind of one of the things you might find tricky is the pressure of having to deal with a lot of different things. And so what kind of accommodations do you think might be in place? So what might help you with that? having multiple things to balance at the same time. So what might in the environment be supportive for that?
Um, in the medical environment, or what environment are you asking me about?
So in a hospital environment, suppose you have to keep
Oh,
track of, say, 10, 15 different things, different aspects of a patient's condition, kind of the holistic side, different organs, all that sort of thing. How is it set up, the healthcare system, to make that easier? So what kind of things could help you with that problem?
I'd say the first thing that comes to mind is the fact that you work in a team. So you can rely on other people as well working together because like it's like they always say two minds are always better than one. So by having a team of people around you, you're able to put things onto the table and quickly decide, which is which and manage that stress.
Really good. So kind of, you think one of the things you might find challenging is going to be the pressure. And I like how you talked about teamwork there. What kind of other things do you might be pressing challenges for being a doctor?
Um, a really big one that everyone knows is handling the bad news and relaying that bad news to the family of that patient. I mean, it's enough, but it's pretty sad to have someone you once saw living, breathing, speaking just die or have a terminal illness, but to say that to someone else and maintain being professional, I think it's really hard because you've got to put away some part of your humanity in order to do that. So,
Definitely. And if I come back to the same aspect for that one as well, what sort of things kind of might help you to deal with that challenge? So if we're thinking about kind of breaking bad news and how you might find it tricky, what might help you to cope with that?
um, that's a bit tricky. I'd say probably, hmm, well, I guess that kind of thing may come with experience, perhaps. Maybe doing prior to that practice scenarios, or when you're shadowing, you learn from those professionals, especially senior doctors who've been doing this for years and years and years. You can see their before and after them handling that situation, probably learn from that. That's what I would do currently.
Yeah, definitely. So you could talk about the learning from maybe people with more experience. If we think
Yeah.
about kind of feedback for that as a whole, kind of how we went through that aspect of the question, I think the first thing is both of your points were really, really good. So, kind of problems with breaking bad news, problems with dealing with multiple things at once. Definitely a good point. But look at the nature of the question. So, if the question is asking, what would you find challenging about being a doctor? And you answer with an example of one thing you might find challenging, the interviewer might think kind of that's quite a surface level answer, or maybe this person doesn't have too many ideas. When actually you did have other ideas, it just took me kind of prompting you to find them. So I would say if we've got a question like this, what would you find challenging? It could be really easy to say, well, I think there are a few things I would find challenging. I think it would be quite tricky to kind of deal with the balance of a lot of different tasks, different attributes of a patient's condition. I think dealing with the resource constraints might be quite difficult, especially with the way the NHS is right now. And I might struggle with kind of things like waiting lists and having to see patients suffering. I might struggle with seeing patients in pain, and I think that that might me kind of make me upset. And because I'm an empathetic person, that might be something I find difficult. And finally, I might find it hard to break bad news to patients, especially about things like death. And then you say, in particular, maybe this is the one I'm going to find the most difficult, and you develop on it a bit more. So you can see on the screen, we've got a few examples here. And I guess my first feedback point would be, if they're asking what would you find challenging about being a doctor, I would try and refer to a couple of examples. So give yourself a structure. Like I think there are a few things I would find challenging, one, two, and three, and kind of this one in particular, develop on it. The second thing is sort of if you're talking about what you would find challenging, automatically refer back to what you would do about it. So, like I asked you that as a follow-up, it's quite likely an interviewer would, but that's something that you can sort of naturally refer back to. So, if someone's asking you about each of these problems, For example, you might find it challenging to deal with patient suffering because you're an empathetic person, kind of you don't like to see patients in difficult scenarios. But that said, you still find it rewarding because you know what a big difference the doctor can make by being empathetic, by being a good communicator, by providing stuff like pain relief. And so you can say, I would find it tricky to kind of observe a patient suffering, but I know that there are these things that I can do, and that would make it still rewarding for me. And exactly like you did when I asked you about Breaking Bad news. So I think main feedback would be try and elaborate on your answer a little bit more before the interviewer goes and prompts you about it.
Thank you. Thank you very much.
No worries. Any thoughts, Sammy, Jeannie?
I think the answers are really good. And yeah, definitely when answering this question, make sure you link it to yourself and how you would deal with these challenges, because it really shows that you've thought about how you're going to manage medical school, which is really important because it's known to be quite stressful. So it's really important to show that you're not naive to that aspect, but you know how to deal with that. So yeah.
And Jeannie, any thoughts?
Yeah, I completely agree. I think it was a great answer, but I do think that you need to kind of have a well-rounded idea of how being a doctor, yes, it's a rewarding career, but there are challenges, and you need to kind of know that you can move past these challenges and have things put in place. And you're going to have things that are going to be put in place for medical school itself, let alone being a doctor. So it's good to kind of think about some challenges and kind of make it personal to you as well. Include personality traits such as being empathetic and really connecting with people like emotionally. It's good if you make things personal and kind of talk about how you yourself would overcome the challenge.
Definitely. And I think to personalize, it might be really nice to link it back to something like work experience. So if, for example, you talk about, say, dealing with resource constraints and knowing that, for example, in the NHS right now, with like children's mental health, there's a very long waiting list. And sometimes you see that patients have to wait for several months. And that's something that I saw when I was doing a work experience in my local GP practice, that a patient who really would have benefited from being seen here and now was not seen immediately, and kind of dealing with the constraints of the system that patients who really would be helped by being seen at an earlier stage kind of are deteriorating because of something like a waiting list. That would be really painful for me to see. So you could say that might be challenging. And it's a good idea, kind of after we've gone through this question, I recommend trying to come up with a list of about 5 or 6 challenges. So you've got some examples here, seeing patients suffering, kind of the empathy side of things, make keeping a balance, exhaustion, kind of long working hours, difficult routine. We've got things like waiting lists, resourcing. We've got unfamiliar scenarios, even stuff like think about the training pathway. So kind of it's a long journey, kind of you're doing many years of training, and that's after doing 5 or 6 years of medical school, would be 5 at Barts. So kind of all of those things as well. Have a couple of ideas, discuss a few of them, and then maybe develop 1 or 2 in detail just so that you're well-rounded. I've got a good question in the chat. How many are a good idea? I think maybe 2 or 3 in detail, but try and cover like maybe a few, like vaguely refer to them in your introduction. We move on maybe to the next one. Let's see what else we've got. So should
Yeah.
we have Ayan? He's got his hand up. And I don't mind if one of you want to ask this one.
Wait, should I just start answering? Or
Yeah, so Ayan, how have you developed your communication skills?
so one of the ways I was able to develop my communication skills is through my role as a senior prefect. I was able to mentor a student in a younger year with who had poor disciplinary record. My head of house essentially told me to try and speak to them and try and get them to open up and understand why he may have done that. And so obviously coming into it. It may be quite awkward for him. I'm an older student. He doesn't really know me, and he's not going to instantly open up to me and talk to me about all of these issues. But the way I was able to develop my communication skills, hopefully try and comfort him with open body language, just trying to get to know him. I'm showing like I'm generally interested in, just asking him generally how he was, trying to find some common ground between us if he played any sports or anything like that, and just trying to make him as comfortable as possible, and then slowly moving more into for example, like trying to explain why I'm actually there, why I'm trying to help him, why I've been asked to see him. And then by making him comfortable, then he's able to finally open up in that scenario. And I think that was really useful and rewarding. And then when he actually does start to open up and then talk about this, show that I am actually listening, actively listening as well, relaying back to him what I'm hearing, maybe giving my like small opinions on it, and showing that, or like trying to understand from his perspective. Maybe he thought some things weren't necessarily fair about certain things he went through, and how I could like agree with that and empathize with that, trying to show empathy in that manner. And so just overall, just trying to be calm, compassionate, and really show that I do care and I am listening and making sure he feels heard. So I think that was a really a rewarding experience for me, and something that I definitely gained a lot from. I think this is really useful in terms of in a medical setting where doctors must do a similar thing when speaking to patients in consultations, making them comfortable, getting them to open up about their feelings, how they're feeling about certain symptoms, and then getting them to actually talk about their symptoms so that they're able to make uh, uh, better judgments and diagnose the patient better if they have more of a holistic idea of what's actually wrong with the patient, and know about all the different symptoms that are taking place. So I think communication skills are incredibly important in that manner, as well as in the multidisciplinary team working with other healthcare professionals as well, to really overall provide the best care to patients as possible.
Nice. So, kind of, I like how you talked about towards the end, you linked it back, and kind of this is me in interview mode as opposed to feedback. So, kind of, we're continuing with the interview follow-up. I like how you talked about kind of communication in the context of the multidisciplinary team and also communicating with patients, encouraging them to open up. So, in particular, if you think about this example of a doctor maybe communicating with a patient, what do you think would be some specific examples of how a doctor could demonstrate good communication? Like, have you ever picked up on anything
Yeah,
during your work experience, during your volunteering? Is there
yeah.
anything that you think would be kind of the characteristics of a good communicator?
So one of the things I was able to see when during my work experience, I was shadowing a pediatric consultant, and there was a mother had come in and she was quite distressed. She was actually crying at the time because her baby recently had an eczema flare up, and understandably, that's quite distressing. It's something completely new, out of the blue, as well as that being your newborn child, and so understandably, she was quite distressed. And so the way that the pediatric consultant actually explained to her about eczema, and she essentially described it as like a desert, and the way she said the whole point of if you want to make like a if you want to like a garden to grow, you water it loads, and this is essentially a desert, and we want to try and make it into this garden. And then she used this like simple analogy of saying how the trying to get to understand the importance of emollients, and really constantly moisturizing the child. And I thought this was a really effective way she was able to communicate using simple analogies to clarify relevant information. Thought that was really strong, as well as because she was distressed. Um, One way in which she was able to communicate was just simply listening. I think that's also a really good way in which she communicated, because sometimes it's not always about what you say, but allowing the patient to actually speak, vent their feelings, and so letting them speak and get it off their chest. I think that's a really effective way of allowing them to become calmer and hopefully relieve some stress.
It's great. Thank you so much, Ayan. So I think on the whole, two very good answers. If we think about maybe some feedback for both of them, I think they are kind of very, very well presented answers, but not necessarily directly answering the questions that are being asked. So I think the key thing for you is you've got all the right stuff and you've mentioned all the necessary things, got good examples, but have you tailored it to the question that's being asked? So make sure it's not the question that you've prepared an answer to, but the one that they're asking. So say we've got here, how have you developed your communication? That's not saying, give me an example of a time where you communicated well. That's a broad question asking, how have you developed your communication? So what you want to do is you might want to give kind of a sort of narrative. So you can say that I found that there are certain aspects of good communication that I observed during my work experience, and they included things like active listening, open body language, being attentive, repeating back to the person what they're saying to make sure they feel heard, using simple language that's easy to understand, using analogies, face-to-face contact, all of these things. So if the question is asking, how have you developed your communication? During my work experience, I saw that these were certain attributes that made for a fantastic communication between the doctor and the patient. And I've tried a few things over the last couple of years to improve my communication skills. And you can give a couple examples. So rather than focusing just on one specific instance of when you demonstrated good communication, you have to answer this question: how have you developed your communication? So what have you done over time? Well, one of the things you've done is you've been volunteering with, I don't know, this peer mentoring scheme. And in your peer mentoring scheme, you've demonstrated all of those qualities, active listening, so on. Then you do what you did. Then you say, in addition to this, I've also done so and so, where I've developed these qualities. And finally, I've also done this, where I've developed these more qualities. So make sure you're always linking it back to how have you developed your communication rather than trying to answer the question, give an example of when you showed good communication. Because what I found maybe in parts, you had really good things where you mentioned specific stuff like open body language, but in other parts, you were mentioning things that didn't really have all that much to do with communication. So you're more kind of describing the nature of like your interaction with the child. That's not really about how you developed your communication. Then for the second part, again, I said, what are the qualities of a good communicator? And you gave me an example and you went straight into an example and you said, what happened in that example? Which is fine. It's really good to use work experience examples, but make sure you start by answering the question. So say, these are the qualities of a good communicator, X, Y, Z. And for example, I saw them in this case and they were really good and they had this effect and they had this outcome. So does that make sense in terms of sticking to the actual question being asked?
Yep. That was helpful. Thank you.
But everything you've said is perfect. Just maybe rearrange the way that you structure it. So start by answering the question and then bring in one example of when I did this was so and so, where I saw these skills being demonstrated. But start by answering how have you developed your communication.
Okay. Thank you.
Yeah, but really, really good. And all of the stuff you've done, definitely discuss it. Just make sure you're kind of linking it back to the question. But yeah, great answer on the whole. Any thoughts, Jeannie, Sami?
Yeah, I completely agree. I really like the points that you brought up, especially the desert analogy that you mentioned. I think that was a very unique example, and it would be great to include that in an answer because you've seen that in real life and you've seen how the doctor was able to communicate such a complex disease of eczema in such a simple way. And a lot of the patients that you would see will not be familiar with medical terms such as eczema. So it's very important that you are able to communicate complex ideas in a kind of simpler way. And as a peer mentor, you may also be able to build on this skill. And it's good that you've got an example of what you observed and then what you've done as well. Those are kind of two very different things that will boost your communication skills. So yeah, like whatever was mentioned earlier, you've kind of included everything in your answer. It's now just about tailoring your answer to the question. But I'd say you've pretty much got what you need. You just need to kind of structure your answer now.
One good framework that we've put here to structure your answers is the STAR framework. So that's just explaining the situation, so a quick summary of like what you were doing, then the task that you had at hand. So for example, with you, it was talking to that junior. Then the action is like what you did to tackle the problem. how that what that resulted in. And then the really big part that you need to focus on is reflection. So what you learned from this, how it changed you, what qualities you've gained, and like how you're going to implement this in the future. Because reflection is just such a big thing in medical school. So it's important that you make sure you can draw good reflections when answering these questions.
Great feedback, Jeannie and Sammy. So I think kind of key take home from this is everything, Ayan, that you've done was really nice. Kind of developing the specific example was perfect. The example was really well chosen. It illustrated exactly what we were looking for. Just make sure, start by referring back to the question. So how have you developed your communication? Give like 3 sentences talking about what you've done, and then say one specific example of when I managed to do this was this, and I managed to develop my skills in these ways. That's my reflection. And the same thing, if I ask a follow-up, how do healthcare workers show good communication? These are the ways that healthcare workers can communicate well. For example, when I was doing my work experience, I had the desert analogy, so on. So just make sure, answer the question, then bring in some examples, and then follow this kind of framework. Let's have next question, next person.
Okay, so our third question is an ethical one. A patient has HIV and does not want to inform their partner. How would you as a doctor respond?
Let's pick Yasmin. I think actually, yeah, Yasmin, your hand was first.
Okay, so this is a very complex ethical scenario in which a patient has HIV and does not want to inform their partner. And as a doctor, I would first have to consider the implications that this HIV would have on the patient. So if this patient were to have sexual relations with their partner, then there is a risk of the HIV being transferred. And as a doctor, I have a duty of candor to not do harm from a non-maleficence point of view. So I would first encourage the patient to tell their partner first, and then if they insist that they don't want to speak to their partner about it, I would possibly try to explain that the potential harm, the risk that it would have on that partner. And if they're still embarrassed, I will also try and seek information on why that possibly is the case, as saying it in a non-judgmental, non-confrontational manner is very important. So I don't want to jump to conclusions and attack them for not wanting to inform their partner. If they don't speak to their partner about the new HIV illness, I would have to explain to the patient that I would have to break confidentiality myself. So obviously that would be a difficult conversation. I would still have to maintain that empathetic approach. And I would possibly try and encourage them to maybe have that conversation with the patient in the room. And as I don't want to do harm to the patient or their partner. So as a doctor, that is what I would do.
Really good. Thank you so much. Let's go through some feedback for that. I'll let Sammy, Jeannie, if you'd like to go first. Should I go for it? Your choice.
I don't mind.
Cool. So kind of really well done in terms of some of the key points you mentioned. So you kind of discussed why. And I think for a question like this, discussing why is really important. So a patient saying that kind of they don't want to inform their partner, what specifically is their concern here? And how can you support them with that? So are they worried that maybe they don't know how to communicate to their partner? And in that case, you can maybe support them. You could provide them with resources on how to discuss topics like this. Are there any support groups? Are there any websites? So on. Are they worried that it will affect their relationship with their partner? And in that case, you could talk to them about kind of different medical options available. So there are kind of nowadays a lot of different medical treatments out there, stuff like pre-exposure prophylaxis, things that can suppress the viral load of people with HIV. And it may be worth referring to these if you can remember them, not essential to do so. But there are medicines out there, and you could say, depending on what the patient is worried about, there are medicines out there that you can use to kind of reduce the risk of spreading HIV to the partner to zero. So it's not necessarily something that they have to be embarrassed about, but they do have to tell their partner so their partner can be adequately protected and they can take these medications. So communicate that idea to the patient. And when you talk about why, that was really, really good that you mentioned why. You could use words like ideas, concerns, and expectations. So find out what are the patient's ideas, concerns, and expectations, what are they worried about, and how that can maybe influence the advice you give. The stuff about encourage the partner to tell themselves, definitely encouraging them to be in the same room, really nice, non-judgmental, empathetic, perfect, really good to mention. I like how you started by mentioning it's a difficult decision. At that point, you could also acknowledge the fact that you might not decide on your own, and you do have kind of a wider team. So if you are a junior doctor, you could ask a more senior member of the team. You could discuss with other GPs if you're a GP, and so on. You had a sentence in the middle where you talked about a duty of candor to not do harm from a non-maleficence point of view. I wrote down that sentence actually. I thought the problem with that was these are all really good words to have, but you don't want to be throwing them in like that all together in one sentence where it seems a little bit forced. So, out of those words we've got, duty of candor to not do harm from a non-maleficence point of view, don't phrase it like that. These are all words that can be used in different contexts. So, duty of candor is kind of duty to be upfront, be truthful, especially if, say, something goes wrong. So, your duty as a doctor to kind of not be dishonest, to communicate things as they are. And in this case, it's somewhat relevant, although generally speaking, we talk about duty of candor in the context of a doctor making a mistake, whereas this is more of a confidentiality scenario. But you could mention it, kind of the duty of candor from the doctor's perspective. But that's not the same as the duty to not do harm. So don't say duty of candor to not do harm. Make sure if you're saying those two things, you explain them separately. What is duty of candor? What is non-maleficence? And so we can see here on the slides what is non-maleficence is this context. So the idea of not doing harm will breaching patient confidentiality harm the doctor-patient relationship, but also not doing harm in, say, the context of not causing harm to the partner. You don't want them to get infected. So that's how you would address non-maleficence. And if you use any words like this, make sure you explain them. Don't just throw in the buzzwords because otherwise it might seem like you don't know what they mean. Final thing here that would be really, really good to know. There are certain disclosable disorders that in GMC regulations, when patients have these, you absolutely have to disclose. You have to break confidentiality. So that stuff like, say, measles, tuberculosis, that is compulsory disclosure if you know that a patient has this. HIV is not one of those disorders. So just because a patient has HIV does not mean that you have to make a compulsory disclosure. The only time that you would disclose is if you think the partner is at risk of infection. So you have to actually weigh up the pros and cons, what the risk is, and you have to assess, is the partner at risk of infection? So the first thing you would ask is the patient kind of sexually active with their partner? Is the partner at risk? And if they are, in that case, it may be necessary to disclose. But it will really depend if the patient just has a partner and that's kind of not a risk that the partner is facing because of what you know from the patient's perspective, then in that case, it may not be necessary to disclose. But either way, you would still encourage the patient to be upfront. So I think that would be worth mentioning. When you say that you have to tell, make sure that you're a bit more specific about that. You have to tell if you think that the partner is at risk.
Okay, thank you.
You're welcome. But really good answer on the whole. Well done. Any thoughts? Yeah, Sami?
Uh, I was just going to say that again, when you're using kind of these words like autonomy, non-maleficence, make sure, like you said, explain what it means, but then also link it back to this situation, just to show that you really understand what you're saying and you're not just throwing out these words. Next, we have some advice on how to tackle the article, which many of you are asking about. So we're going to get to this now. One acronym to think about when you're reading the article is PANDA, which stands for purpose, author, nature, date, and audience. So purpose is thinking about what the article is trying to do. Is it informing the public on a health issue? Is it telling people about a new and upcoming change in healthcare, that kind of thing? With the author, you should think about whether this would create any bias in the article and the reliability of the author. The nature of the article, you should again think about what it is intending to do. With the date, that then links to how reliable the article is again. So if it's a recent article, it's more likely to be more up to date with the statistics. Whereas if it's a couple of years back, you can talk about how things might have changed since then and whether the statistics are reliable. And then finally, with audience, that's whether it's directed at the general public, healthcare professionals, higher education, and whether it's accessible to the audience as well. So if it's just available online, that can limit its accessibility. And yeah, so just link it back to the accessibility of the source as well. It's really important to read into the relevant hot topic that the article is referring to and its impact on the NHS. So make sure that you have read other articles related to it and that you're really aware of the relevant issues in the article. There may be like some small underlying issues in some lines, and it's really good to research into as much of it as you can. And then it's also good to form your own opinions and create a balanced argument and make sure you back this up with the relevant information and statistics. And then finally, make sure you link the article back to your ethical points, such as the 4 pillars, confidentiality, and mental capacity. Jeannie, do you have anything to add about tackling the article?
So I think you've pretty much covered most of it, but I did see a question in the chat that says, what's the difference between purpose and nature? So I just thought I'd like clear that up while we're on the slide now. So purpose of the article is just basically saying what is the purpose? Why was it written? Was it written to inform? Was it written to educate? Was it written to argue a point? That sort of thing. And then from that, you can kind of link that with bias. For example, if it was written to argue a point across, how reliable is the article? And, is it fair? Is it biased? That sort of thing. So that can also link to authors. So kind of with the author, is the author qualified to talk about the topic, and does the author possess any bias? So just kind of going back to the question, purpose is why was the article written, and then the nature of the article is kind of like what form was the information written in, and where was it published? So kind of looking at, for example, what news outlet was this published in, or was it published in a journal where articles in that journal are reliable, that sort of thing. So just kind of seeing the source of information and whether it can be trusted or not. That's pretty much all I had to add.
Brilliant. Is the next slide the article? Yeah. So I will share the link to this article in the meeting chat as well. And what I shouldn't stop. I will also try and share the actual article with you, if that works. So either open the article from the chat, or if you can see it on my screen now. So we've got the article here, and I wonder it might be easier if we just stick with the first part, so the first page, as we don't want to spend too long on this. So you can see to start off with that we've got an article in the BMJ, British Medical Journal, and it's about do smoking bans work? So I'll give you maybe 3-4 minutes to go through this, and we'll scroll down in a little while. And then we're going to finish off by discussing the first page of this article. Obviously, in your actual interview, discuss the whole thing, but I don't want to make you read 4 pages just now. Actually, had a question for Jeannie and Samir. For the actual article they send you, have they given any kind of briefing as to whether the students are allowed to discuss it with anyone? With who?
So in the email that you received, I'm pretty sure that it will say not to share the article with anybody else. But that doesn't mean that if, for example, if the article is about smoking like this, that doesn't mean that you can't discuss the topic of smoking with other like healthcare professionals or your teachers and things like that, because that can be quite helpful. But you just shouldn't like send out the article to other people.
I think that makes a lot of sense. So, kind of, you have to keep the article to yourself. It's probably not appropriate to kind of share that with your friends, tell other people, but you absolutely can have a discussion about smoking and you can use the internet research about it. And yeah, when people have read the first page, do let us know. So just as soon as you've read through the first page, not the whole article, and that's the first page just that you can see on the screen here. So just put in the chat now what stage you're at. Have we almost finished it? Are we done? Are we not done? Still reading. So if anyone would like to start discussing this, and it's just the first page, remember, maybe put your hand up now. We have anyone keen to begin to discuss this article? And so, yeah, Rishik.
Okay, so when talking about this article, I think it's important to understand that the smoking ban that's like the bill that's been proposed is quite radical, as the article points out, in comparison to legislation that's gone out around regulation of smoking globally. So I think the second paragraph and the third paragraph kind of highlight how, although these kind of moves have been considered in the past, they've been kind of they've people have gone back on them. For example, New Zealand have said that despite having proposed the idea of banning smoking overall, the proceedings were halted. Now, this could either be because the general public or the party in power thought it wasn't the necessary thing to the most appropriate thing to do in the welfare of the nation, or it could be just be kind of like lost in bureaucracy in the changing over post-election. So that doesn't really help in terms of understanding whether it is the right way moving forwards. However, if you go on to the fourth paragraph, it talks a little bit about how vapes, like the rise of vapes, which kind of correlate with the decrease in the prevalence of smoking. And I think that's something that's very important to consider when looking at the smoking ban in particular. Um, Especially in the UK, where I think it's like a very quite obvious increase in the use of underage vaping and like vapes has increased in comparison to smoking. So I think that's a very important kind of a factor to consider alongside the idea of a smoking ban. So this raises a kind of idea that if we do ban smoking, isn't the prevalence of vaping going to increase at a much, much quicker rate? And isn't that going to be much more difficult to kind of assess because we have a worse understanding of how vaping affects the body in comparison to how smoking might affect the body. So
I just stop you there. Really, really sorry.
okay.
Great summary of kind of what the article is covered. And I maybe ask some specific questions about this. So to start off with, we can see this is an article in the BMJ, and we got the title, Do Smoking Bans Work? And as you've just done really, really nicely, you've given me a summary of maybe how it's quite a balanced perspective. So, what are some of the benefits here that have been suggested, but also what are some of the practical downsides? And so, based on kind of what you've just told me, what do you think the perspective of the BMJ in this article is? Do you think that they work or that it's maybe not such a good idea?
So I think what's being hinted at towards, especially towards the bottom of the fourth paragraph, is the idea that these like harder smoking regulations have started to work. But then again, the next section about being a mixed bag of evidence, uh, kind of starts proposing like the idea like against that, showing that there's what a 2.35 to 3.29% average reduction in the adult population who smoke tobacco. So yeah, and it's also saying that it's very difficult to measure the rate at which, or like to kind of quantify things like indoor smoking bans and how they affect the public, and how it might not have any impact at all. So where it says um, the studies that have been conducted did not find any significant impact on smoking prevalence, and warned that they could even increase smoking intensity amongst people who smoke every day. So I think in general, from just the first page of the article, I think it's suggesting that um, it could go both ways, as in it could be a positive in helping the kind of youths like stay away from tobacco. But I think in general, the perspective seems to be shifting towards the idea that this like an overall smoking ban won't really work, which kind of ties in with probably the values of the BMJ, which would probably be linked to the kind of ethical pillars, especially those of autonomy, and something like a blanket smoking ban would be going directly against the autonomy of a person.
Really nice, Rishik. So if I kind of ask you a little bit more of a follow-up based on that. So, kind of as you've told me, the BMJ seems to be relatively balanced. So, you can see they've presented what is called a mixed bag of evidence. And they've given examples of when it's worked, and they've also given examples of when it hasn't worked. So, we've got, for example, smoking rates in France, and they've actually risen by 1.6 and 3.6%. So, in your opinion, why do you think that might be the case that maybe smoking bans have been ineffective or even potentially counterproductive? So, what do you think might be some of the things that could go wrong?
I think it relates to a lot of different factors that can affect rates of smoking. So if we look at it in kind of like just smoking itself is increasing, if we just look at that as the factor that's changing, then you could probably make deductions about how maybe presentation of smoking in the media have kind of promoted the increasing like use of cigarettes despite smoking bans, or partial smoking bans or regulations on smoking. But you can also look at it from a kind of wider standpoint, and you can think about have there been changes in the demographic of the country as a whole? And something you can probably pick up about France, especially in like recent years, as the example in the article, is that it can start to have like it's starting to have different levels of economic and political turmoil, which could lead to kind of a wider like proportion of the population being less educated and having lower incomes. Although that's not to say everyone in France is obviously like not wealthy and everyone in France isn't educated. You can like probably look for a correlation there and say, oh, because the levels of education are decreasing, then less people are able to understand the impacts that smoking has on their health, and consequently, and alongside something like the popularization in like culture of cigarettes. This has led to like an increase in smoking despite regulations trying to decrease smoking.
Yeah, very reasonable. So you've talked about kind of presentation in the media and stuff like income, socioeconomic status, education, all really, really good points. You could maybe address the fact that smoking is intrinsically addictive and kind of that pe these people, besides a ban, may also benefit from psychological support, that kind of intervention, what that could do for them. You could also think about maybe enforcement, that side of things. Really nice.
Thank you.
And kind of to finish off, so we've talked about one option being a full smoking ban, and you can see that the BMJ is not a huge fan of this. It's talks about it being a mixed bag. And so a couple of other solutions just in the first page of this article have been discussed. So could you tell me a little bit about maybe what some of the other solutions could be? And out of them, kind of do any stand out to you that you think would be some of the better options?
If I can just take a quick moment to skim through the article again, because
You get 2 weeks in the real thing, not 2 minutes.
I think the main kind of idea that's been discussed in the article is that of like e-cigarette use as an alternative to smoking, but it doesn't really portray that as something um that's going to completely fix the problem either. But I think you were more talking about alternatives to a smoking ban, so
It's not kind of
um
a full smoking ban altogether. And what kind of maybe other things have they discussed in terms of maybe bans that don't involve like a complete ban on smoking altogether?
all
So
right.
what other things have they either mentioned or maybe alluded to in like the second part of the first page?
So at the very bottom, it talks a little bit about marketing campaigns and lobbying politicians. So I think what's kind of being alluded to is the idea that you can curb advertising of smoking products, and that would be a more effective way of controlling smoking because in that, like, or smoking in the terms of decreasing the rates of smoking, both in the people who are already smoking and also those who are picking up smoking in youth and things like that. And I think, from my own opinion, I think that's probably going to be like a much better way of tackling that as well. And the reason I think that is, so recently, I looked at a company called Japanese Tobacco Initiative, which are like a multinational company that go all over the globe to kind of take tobacco leaves and use them to make tobacco for cigarettes and things. And things that these companies do in under the guise of like corporate social responsibility is like take control of things like smoking vaccines or something that's been kind of proposed in healthcare, and then use that to kind of um make smoking seem like there aren't any risks associated with it anymore. So this kind of manipulation and exploitation that kind of arises with these companies having so much power and these marketing campaigns having so much like such a great sphere of influence is what leads to the problem of smoking getting bigger and bigger and not being curbed by things like indoor smoking bans and increased regulations. So I think as the article's kind of leaning towards, it's probably a better alternative to a complete smoking ban would be to introduce kind of regulations on advertising and marketing campaigns and looking at how these like transnational corporations are working as opposed to just having a blanket ban.
Really nice. Thank you so much, Rishik. And I really like how what you did here is you linked the knowledge in the article. So in the article, what does it say here? It talks about kind of aggressive industry, marketing campaigns, lobbying politicians. You've talked about that, but you linked it back. So firstly, you made the jump that, okay, one potential solution could be that we target the marketing. And then you actually discussed it in your own perspective. You talked about KB, what would be the pros, what would be the cons of doing this, and you actually kind of compared it to the idea of a smoking ban. So this is the kind of thing that I guess if you're being asked to analyze and discuss, one is exactly like we heard from Jeannie and Sammy before. So the idea of kind of actually evaluating the article and analyzing it. So like what is written here? What are they saying? What are the pros and cons? Why are they saying this? Who is the author? What is their narrative? Where is the article published? Is it reliable? So on. But I guess the second half of it is being able to kind of use the article to bring in your own original thought. And that's what you did really well there, where you kind of talked about why maybe a smoking ban might not work. And you talked about kind of things like education, things like media campaigns. And then kind of you came up with your original idea based on the final paragraph of, well, I think we could do this instead. And I think that would be more effective. I think that's exactly what you'd be expected to do in the real thing. Really good work, Rishik. And I think that should give people some idea of kind of how to balance discussing the article, but also how to balance bringing in your own perspective, depending on what the interview asks. So, any thoughts, Jeannie or Sami, about the article or Rishik?
Yeah, I pretty much have to agree with you, to be honest. We did include the panda structure as kind of a guideline to analyze, and you've done that so well on the spot as well. Like you mentioned, you would have 1 to 2 weeks to prepare. So being able to do that on the spot is brilliant. And not only that, but you've also formed your own opinion based off of it. And in your answer, you kind of discussed different viewpoints because of how balanced the article is. It kind of discusses one viewpoint versus the other. And that's something that would really stand out in an interview because you're showing that you can kind of appreciate different viewpoints and see how people would think about it, but then form your own judgment based off of that. So I'd say, yeah, really good answer. Well done.
Sami, any thoughts?
Yeah, I definitely agree. It was a really good answer, and especially for on the spot, considering you have much more time to prepare before the actual thing.
Amazing. So I think that kind of brings us to the end of this. Hopefully people have an idea sort of what does the Barts course look like, how we're going to answer why this uni, and kind of this is what's unique to Barts versus other unis, this article thing. So hopefully people have an idea of what the conversational style might look like. And Rishik gave a pretty much exemplary performance there of what sort of things to do. So that was brilliant. Um, yeah, maybe we can do some Q&A if Jeannie, Sammy, you got some time. Maybe like 5 minutes of that.
Yeah, absolutely.
But yeah, feel free, anyone, if you need to go. We have run over a little bit, so feel free to go if you need to. Recordings will be on YouTube, don't worry. So I'll send you our YouTube channel just now. We'll try and answer the Barts ones especially to get the most value out of this session. So let's see if there are any Barts oriented questions. Personal statement. Sammy, Jeannie, from your experience, how big a part was it?
Um, I think it varies from interview to interview. The interviewers, I think they would read your personal statement, but then it's up to them for whether they'd want to ask. So in their question, they might not necessarily say, you mentioned this in your personal statement, can you elaborate more? They might just ask you a question based on what they've read in your personal statement. So, for example, if you've talked about work experience, then they might ask you a work experience question just because they know that you've got things to say about it because of that's what you've written in your statement. So I don't know, it can really vary, to be honest, and interviewers will not ask everyone the same thing. I'd say it's definitely likely that they could ask about your personal statement. So I think you should definitely refresh and kind of read over what you've written, maybe even think about what they could ask from it, and just make sure that you're aware of what you've written and that you can elaborate and expand on your experiences.
Some people talking about the article in the interview, Jeannie's answered that, so you don't have access to it. What are some good societies to mention when answering why Barts? So if we try and break this down, let's have one example of like a careers-based medical sort of society, maybe one example of like some cultural societies, and one example of some like fun, sporty, that kind of thing. If you can give like three examples of some cool societies.
Also, make sure you link it back to work-life balance if you're talking about like a fun
Sorry, that,
society.
that was me asking you guys a question. So can you help these guys out with some examples? One, do you know any sorts of career-based societies like oncology, med tech? Is there stuff like that?
There's
Um,
a
yeah.
plastic society that like some of our flatmates really enjoy. A hematology one that quite a few people like as well because I think their socials are a bit fun as well.
Okay, so that's your science. You got stuff like hematology, plastics, different specialties, and you can obviously look on the website too, depending on what you're interested in medicine. So that's your science side. Then we can go on to like the cultural ones. So are they like different religions, I'm guessing, different ethnic groups? What's
Yeah,
around?
so Barts is very diverse. So there are definitely a lot of cultural societies. Like I know there's Islamic Society, or we call it ISOC or Tamil Society. And yeah, there's like Indian Society, there Arab Society, I believe it might be a new one, I think. So there are definitely loads of cultural societies, and they host a lot of events as well, where whether there could be social ones. They may also host revision sessions together. So each society might kind of help you out in their own way as well, depending on how they've learned. So there are definitely lots of cultural societies, and they do also host a lot of cultural events and balls and things. So yeah, there's a lot of variety.
Amazing. So we're answering why Barts. We're talking about point number one. I really like the course. Why do I like the course? Well, we've got a spiral curriculum. I keep revisiting topics, spaced repetition, something I really enjoy. We've got prosection, really nice way of learning anatomy because you're being demonstrated it by experts. You're being presented it in a really easy to learn way. And you've got kind of integrated approach, early patient care. Then you've got point number two. You really like the hospitals attached, lots of learning opportunities, diverse community, and lots of research going on. Intercalated degree, that's your point number two. You've got point number three, location. You really enjoy the location. And then you go on to point number four, societies. You mentioned that you've got this career society that you enjoy. You'd like to do hematology. You've got cultural societies that you'd really like to do. Like if you're a Muslim, you'd like to join ISOC, maybe you'd like to join India SOC, and you know that there's a really good sense of community because you've talked to two medical students in their first year at Barts and they've told you that there's a fantastic sense of community here. That makes you really want to come. And your third point is going to be you're also going to do things to help you relax. So maybe like sports, that sort of thing. And so for the relaxation side of things, what is available at Barts? Jeannie and Sami.
Sorry, can you repeat that last bit of your question again?
So the last bit is we're going through the interview structure and they get to the end and it's like there's stuff here for me to do to relax. What's that gonna be? So are there like sports societies? Are there events, welfare things?
Yeah, so I'm part of Netball Society, and that's they've got training every week, which is like good to like get away from revision, studying, that kind of thing. There's a rowing society, volleyball. There's a bunch of sports societies, and you can do like a recreational one if you're not into the competitive aspect of it, or you can do like tryouts for the competitive teams as well.
Amazing. So it looks like everyone's got an answer to why Barts now. Point number one, you're going to talk about the curriculum. We've got the spiral, we've got the pro section, we've got the integrated approach, early patient contact. You're going to link each one back to yourself, link each one back to why teamwork matters. We've got everyone talking about the hospitals and the research, the diverse community, and then the societies. Should all be sorted there. When it comes to patient diversity, what are key points that should be mentioned? I think kind of patient diversity, one, in terms of the conditions you see. So just like Jeannie and Sammy were talking about, kind of certain conditions are going to be more likely in, say, Asian population, stuff like type 2 diabetes is going to be more prevalent. Also, I guess you might see certain conditions, things like, say, sickle cell anemia, are more common in ethnic minority communities than others, particularly like Black African. You've also got stuff like, say, tuberculosis, international kind of global health diseases, infectious disease. Occasionally you see in London, pretty much nowhere else in the UK. So one is like the kind of conditions you're seeing. But two, I think that's probably more important, is that patient diversity is going to make you a better communicator and a more all-rounded doctor. Because kind of you're learning how to interact with kind of lots of different diverse groups of patients from a really early stage. You're getting to interact with all different kinds of people, and you know that kind of it's really important to be culturally sensitive as a doctor. And being in an environment like Queen Mary or Barts for your training is really going to help you with that. So for diversity, it's what you're going to see and learn in terms of conditions, but also what you're going to see and learn in terms of communication skills, different types of people, diverse environment. What are some things that are not so good at Queen Mary? Jeannie, Sammy.
Difficult question, to be honest. I'd say, okay, this one's obviously up to personal preference, but at Barts, because you've got Queen Mary's, which has their campus in Mile End, and then you've got Barts Medical and Dental School, which has obviously campus in Whitechapel and then some things in West Smithfield. So there is kind of a distinction or a separation between Barts and Queen Mary's. So I just firstly I want to emphasize that in your interview, make sure you refer to the medical school as Barts and not Queen Mary's. But if you think it would be a disadvantage, I mean, it's just that medical and dental students are kind of slightly more separated than Queen Mary students who may pursue kind of non-healthcare courses. So it really just depends on personal preference. Like I personally don't mind it because people in my accommodation, we all do medicine and some people do dentistry, and it kind of everyone can kind of relate and we're all in the same boat and we all study together and things. But if you want to make friends outside your course, it might be slightly harder just because Barts is kind of separate to Queen Mary's. But obviously there are things to overcome that. So if you're part of Barts, you are also part of Queen Mary's, which means you can join main Queen Mary societies as well as Barts societies. So kind of linking back to the previous question, you can look into Barts societies for kind of medical specialties and medic sports, but you can also look at Queen Mary societies. For example, they might have a cultural society that Barts might not have, or they might have a general kind of enjoyment society. Like I think there's a Queen Mary's bubble tea society that Barts doesn't have, that sort of thing. So just my point was just that Barts and Queen Mary's, there is kind of a distinction because of the separate campuses. So if you think that's a negative, I just wanted to put that out there.
Really good. And I think it answers a different question we had from Shruti as well. At Barts, you hear that you can get into a medic bubble. Is that a good thing? Is that a bad thing? Well, it sounds like that's been really well answered. So they're kind of pros and cons of both. Rishik asking, do people actually go to societies? Well, I'm guessing so, otherwise they wouldn't have them. Hopefully. What's nice in the location? I heard it was not a nice area from someone called iPhone. So what do we think? Do we like the area?
Okay, to be fully honest, like before coming to university, I had the same thing. And so I was worried. But when you get here and you like settle in, it's really not as bad as people make it out to be. And like I don't feel worried walking around or anything. I mean, anywhere that you walk around at night, like it's probably best to go with a pair or like go with another person. But the area is fine. And it's got like the tube station, which is really close by, and that has like really good links to central London and other places, and it's just really quick to get around as well.
Yeah, there must be more food options around than like I have in Oxford. So that must be a benefit, I think.
Yeah, if it
Yeah,
helps you
there's
guys,
a
we're
lot
going to
of
be
fried
doing a lot of
chicken.
this.
There's a lot of fried chicken. If that's what you're into, you'll be in luck. There's a lot
We
of
have a
fried.
24/7 McDonald's right here.
I think we've covered most of the questions. I guess let's do one last one. Do you ever have to travel around to kind of different environments on the tube, different campuses, or is it quite on site?
I think things are pretty much like very close by because London's quite small if you think about it. Like things are close. So Whitechapel is kind of like a central campus. Most things will be in Whitechapel. You'll have your lectures there. You have some labs there. There's the Garrod building, which is where you might have a lot of society socials. You have PBL in the Garrod building, which is in Whitechapel. So a lot of things will be in Whitechapel. So if your accommodation is Whitechapel, then you'll be completely fine. It's like a 3-minute walk. If you choose to live in Charterhouse Square, then you would probably have to take the tube or you could take a bus, depending on how much time you've got. Mile End is 1 mile from Whitechapel, so we tend to have labs in Mile End there quite a lot. So you could walk the mile. It does not take long to walk the mile, but you could also take the bus or you could tube it. And then we have clinical skills and communication skills in the West Smithfield campus, which is slightly further away. Most people do tube that one, but it is also, I think, a 45 to 50-minute walk. So it's up to you and how you want to commute, but things are very, very tubable for sure.
There's also buses as well, which are quite easy to take to the West Smithfield campus.
Amazing. So I think well we're getting quite yeah, we're a little bit over, so probably let's leave things there. But hopefully that was helpful for everyone, and at least some of you got your questions answered. People asking specifically what questions were about, we unfortunately can't share info about that. But hopefully you got some help with that. Let's let Jeannie and Sammy take a break now as well. And yeah, good luck, everyone. Hopefully, you are at Queen Mary in a year's time. At Barts, not Queen Mary, at Barts. ARC want an outline for why medicine. Really quickly, divide it up, kind of start with an introduction, make that something personal. So, why medicine for you? And that could be like a personal example, personal scenario, or maybe like something you've read, or like a specific reason you really like science, whatever it is. Then give it like an introduction. So, talk about the different roles of a doctor. Start with like the clinical, what you do as a doctor, working in a team, dealing with patients. Give some examples from your work experience, then go on to like the academic side, what you do as an academic, what research you can do. Then go on to like maybe the management side, leadership, that side of things. And finally, you can talk about maybe more broader ideas like lifelong learning, or even like portfolio career, what sort of things doctors can do there. So like, try and break it down into a few dimensions. Start with an introduction, clinical and work experience, bit about research, bit about leadership, like that. Break it down. Quick answer for why medicine. So let's leave things there. Should we end the meeting?
Yeah, I guess so.
See you guys later.
Oh, do I have to end it if I started it?
Let's see, should we let the students leave? I don't mind. There are only like five of them.